Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Wohler, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Hi, welcome to the Functional Medicine Doc Talk program. I am your host, Dr. Kurt Wohler. And in this interview, we're going to be talking about cannabidiol therapy, or CBD. Something I'm familiar with, but I'm not as familiar and used to using this therapy as our guest is. Dr. Dani Gordon from the UK joins us. She is a Canadian and British physician, and so she is a specialist in this topic. So I'm really excited to get into the information here. So Dani, welcome.
Thanks, Kurt.
So before we get into the discussion about CBD, give us a little bit of background on your overview of your education, your training, and really, probably most importantly, is how you got interested in the use of cannabidiols.
Yeah. So I'm a conventionally trained medical doctor. I went to medical school in Canada in the usual fashion. And then originally I specialized in family medicine. I wanted to be a family medicine doctor, and I wanted to do holistic care essentially. And then I went on to do integrative medicine training in the States, and I brought that back to my practice. And that's basically what I started doing when I first, hung up my shingle, I guess it's over a decade ago, decade and a half ago now, I guess. And how I got into cannabinoid medicine, so the use of cannabis-based, plant-based medicines, is I was finding that a lot of patients were coming to me with complex chronic illnesses, complex chronic conditions, because I was an integrative MD. But it was interesting to them sometimes that I didn't know anything at the time when I first started about cannabis, because a lot of them, especially in Canada, especially kids, parents of kids with autistic spectrum disorder or epilepsy, adults with chronic pain, adults with cancer, they had already kind of gotten ahead of me and had tried cannabis in some shape or form for some of their ailments. And even though I was using herbals, botanicals, mind-body medicine, all these other integrative medicine tools, I just wasn't using cannabis. And the reason why was because as a conventionally trained medical doctor, you're basically taught in medical school that cannabis is going to make everyone go crazy and psychotic, and there was literally no place for it as a medicine.
Right.
Despite the fact that at the time, even when I was going through medical school in the early noughties, it was already legal to use medical cannabis in Canada. Nobody knew about it. We just weren't taught about the endocannabinoid system that we have in our bodies. It was a complete black hole. So I essentially started to learn about the endocannabinoid system. I started to study. I took mentorship under the few people who were actually doing it at the time, and started getting really interested in cannabis from my patients. And one of the first ways I really learned about cannabis from my patients was I was working in a really small community part of the time as a locum in Salt Spring Island in Canada. And there was a herbalist, not a medical person, just a guy who used to give cannabis oils to my patients who had these chronic pain conditions, cancer, a variety of things. And I knew about him, but of course he wasn't a doctor, it was kind of semi-legal. So I actually invited him to come speak with me after I finished one day. And he came in and he really smelled like cannabis. He's this older herbal gentleman. And he actually taught me a lot. And I was kind of the first doctor who ever wanted to talk to him, first of all. And I was just really curious because all these patients were going to him for this cannabis oil. So after that, I decided to find more about how to prescribe it legally and so forth. And I joined a practice where that's what they were doing. So that's basically how I got started. And then after I wrote my first few prescriptions with great trepidation and kind of, nail biting, I just, found that it had such an enormous positive benefit on my patients, especially when it was properly prescribed and properly controlled, that I just became a huge advocate for this as a tool in the integrative medicine toolkit. And since then, I've treated, many thousands of patients.
So it's interesting that individual you're working with. I mean, I look back on my career, some of the most brilliant healers, practitioners are non-physicians. People who figure things out themselves, study things on their own. There's some really super bright very smart individuals out there. I think sometimes as, conventionally medically trained physicians, we can get very locked in certain paradigms and not be able to get outside that box. The other thing you mentioned, which was kind of funny, which sort of flashed to me when you mentioned about, using cannabis and everybody's going to go crazy, was that movie Reefer Madness that came out. I don't know, was that back in the 30s or something? And that was a total propaganda type of movie. So, by the way, your practice, is it mostly pediatrics? Is it mixed? Do you work with adults? What do you tend to specialize in?
It's mixed. So when I first started out, it was adults. In Canada, I just treated adults. But as I got more and more comfortable, and when I moved back to the UK in 2018, cannabis medicines had just become legalized in the UK, and there was no one who knew anything about medical cannabis in the UK. I was training the first physicians here in the UK on a variety of specialty areas. And even though I had done mostly adult practice, of course, I knew a lot about pediatric uses of cannabis because I had another practice partner who treated the kids with epilepsy in Canada. And I just did a lot of, conferences and education and mentorship groups. But I had never been the person in charge of the pediatric cannabis stuff before. But when I came to the UK, no one knew anything. So I started to get some more mentorship from people like Bonnie Goldstein, who was, pretty much the world leading expert in pediatric cannabis. She's based in California, and some other colleagues, across Canada. And now we do see a lot of pediatrics, and we're the only clinic in the UK that will actually consider medical cannabinoid therapy as a treatment for under 18s. So it is an area that is in great need. Especially the kids with epilepsy. We treat a lot of treatment-resistant epilepsy. We have a top neurologist who works with us, neurodevelopmental psychiatrist, all of who I've kind of trained up in cannabis. So now we do a mix.
Great. I want to come back to the epilepsy aspect, because that's where I first was introduced to this therapy a number of years ago. Interestingly, many years ago, I, on a few occasions, had prescribed Marinol, which is synthetic THC. And it was something that was actually being discussed in the autism world, particularly when I was in Southern California. There was an organization actually in San Diego that it wasn't the only thing they emphasized, but it was one of those things that came up in discussion, sometimes in conferences or in newsletters. And, from my recollection, it was one of those things that it helped a few. It wasn't like I was prescribing a lot of it, but that was my early introduction to this whole sort of cannabis type of discussion. So let's get into some specifics here. Walk us through the differences in cannabis when we're thinking about the CBDs, the THC, therapeutic benefits of some of these things. And I know our discussion can go quite in depth. So please feel free to go in depth, that you feel is appropriate. Just to give the audience some sort of backdrop as to what we're talking about here.
Sure. Yeah. So the whole, cannabis-based medicines, cannabinoid medicines, there's lots of different terms for this area of medicine. But essentially what we're talking about when we're treating people medically with these plant compounds is the plant compounds, the active compounds from the cannabis plant. The two most common compounds in the plant that the plant produces most prolifically are THC and CBD. So CBD is non-psychotropic. This means that it is psychoactive in the nervous system, but it does not make you feel high or stoned or impaired. CBD works differently in the endocannabinoid system, which is the natural system we all have to process cannabinoids in our brains and our bodies, than THC. So, for example, CBD, not to get overly technical, but it doesn't necessarily bind to either of the two main cannabinoid receptors with tight affinity. It doesn't lock onto them very tightly. Instead, it kind of moves around the endocannabinoid system and also contacts other systems like the serotonergic system and connect as a second messenger. And it's almost like this conductor, this modulator, if you will, of the whole system.
So, Rip, is it acting? So it's not necessarily binding to the endocannabinoid receptors aggressively or very strongly, is it tending to make those receptors maybe more reactive to other substances? Even within the neurotransmitter, like the serotonin receptor. So it's maybe just having this augmenting effect in enhancing overall function in general.
I would say I would say it augments
Okay.
I would say it augments and modulates depending at on the receptor. And we're still really learning a lot. There's probably many things that it does that we don't totally understand. But some of the things we know it does is it has a profound anti-inflammatory effect. It has an immunomodulatory effect, so we can use it in conditions like autoimmune conditions, for example. It has an anti-epileptic effect or a seizure, basically decreasing the number of seizures people with some forms of epilepsy have. It has an anxiolytic effect, meaning it can lower anxiety levels. It has an effect on cortisol on the HPA axis. It has effects in the gut, in the gastrointestinal system. So this is kind of the CBD. Then we have the THC. Okay. THC is the chemical in the plant that everyone knows that makes you feel quote unquote high or stoned if you take large amounts of it, especially if you inhale it via vaporization or smoking. THC, unlike CBD, binds most effectively to one of the receptors called the CB1 receptor, and those are really concentrated in the brain and the nervous system, although there are many other places as well. So THC, for the medicinal benefits, when we use it in micro doses or small doses, is generally not enough to make people feel high or stoned. Obviously, my patients do not want to feel high or stoned, first of all. That is exactly the opposite of what we are trying to do. A lot of my patients have brain fog. They have cognitive disturbances, cognitive dysfunction. We do not want to make that worse. We want to make them more functional.
Right.
And that has to do with the dose response effect with THC. And at low doses, medical doses, instead of seeing those kind of paranoia symptoms and the high and stoned feeling symptoms, we get things like pain relief from muscle spasm, help with sleep. A lot of pain is one of the main ones, actually, and sometimes some help with some of the neurological conditions. And we have some pretty good evidence, although it's still fairly preliminary, but it's growing in nature, that small doses of THC as we get older is actually neuroprotective. So again, contrary to what we've all been told that, cannabis is THC in any amount is going to quote unquote rot your brain or cause brain problems. Actually, it seems that it is neuroprotective in small doses.
So what qualifies as small dose? Let's say a small dose of THC versus a large dose.
Yeah, that's a great question. So unlike other medications, and this is something that comes up when I teach a lot of conventional MDs, medical doctors, about how to prescribe cannabis. And one of the most difficult things as an MD to get your head around is that this is a botanical medicine that not only does it have CBD and THC, which I'll get into in a moment, it also has minor cannabinoids, other plant chemicals that contributes to the effect. But even the CBD and THC by themselves, everyone has a slightly different threshold for what dose is best for them.
Okay.
And that is really hard to wrap your head around when you've been to medical school and you were taught, this is the set dosing regimen for this drug. You start here, you titrate up, and da-da-da-da-da. It's very linear. So that being said, we start with usually 1 to 2 milligrams for adults of THC, usually at nighttime to begin with, sometimes during the daytime if they have a lot of pain. And then we slowly increase by between 0.5 milligrams and 2 milligrams, depending on the person, depending on their symptoms, depending on if they're THC naive or not, over a period of weeks. For children, we dose it based on even smaller doses and based on their weight, based on the milligrams per kilogram we get children. And that's with CBD and THC. Generally for kids, the CBD is much higher than the THC. The THC is kept very small. So it would be very, very odd for a child, someone under the age of 12 who is on cannabinoid therapy to ever, go above 30 milligrams a day of THC. Normally it's 2 milligrams a day of THC, but it can vary depending on the indication we're using it for.
I mean, there's all kinds of things like that in medicine where we dose. You start with a specific dose, but you may need to change the dose. That happens all the time. It's not, I mean, that happens with many medications, and it happens plenty with many of the natural substances we use. Some of it could just be absorption, utilization, breakdown, metabolism, genetic influences. So it's certainly not a stretch to think that certainly would apply to THC as well as CBD. So we have CBD.
Well, we don't think so because we're the converted. But you have to remember, most of the doctors I teach, this is the first thing besides the pill they've ever prescribed someone. And even with conventional medications like you, Kurt, if I'm using a conventional medication, oftentimes I am looking at the metabolism of that person, their cytochrome P450 system like you. I am saying, okay, maybe we'll start with 1/10 of the dose and we'll get a liquid form. But most medical doctors don't think like this.
Right. Well, and you have to do that when you're working with certain patient populations. Many of the autistic kids are extremely sensitive. Same thing, I'm sure, with somebody with certain types of mental health challenges, neurodegenerative conditions, and certainly epilepsy. So that whole start low, start slow principle is something that I've always applied, in my years of practice. So we have CBD, and has broad influences. Inflammation control, immune control, neurological function, THC, pain, for example, as you mentioned. I'm curious, does THC or perhaps CBD, but let's just say THC, does THC positively augment the effects of CBD and vice versa? Are they having an influence, sort of synergy? They're coming from a plant, so a lot of these things are synergistic in their effects. I'm just curious what's known about that.
That's a great question. So I'll give you a somewhat complicated answer. So there's very little in the way of randomized placebo-controlled trials that is, quote unquote, proving that CBD augments the effects of THC or CBD decreases the side effect potential of THC, that sort of thing. But when we look at things clinically, when you've treated thousands of patients over a decade, you start to notice things. And we speak to other people, other experts in the field that have done the same, you start to notice the same things, and that's probably something that's significant. So I would say yes, they are synergistic in the sense that when we use full spectrum medical cannabis oils and products, full spectrum inhaled medical cannabis in some cases, you get a better effect than when you use isolates by themselves. And actually the best published evidence, if you're going to get, if you're going to be a real stickler for what's the best research out there for this, comes from epilepsy, actually. So we know that the kids who are given CBD isolates, which are basically CBD that's been purified and purified and purified, nothing else in it, or get a licensed medicine called Epidiolex, which is essentially purified CBD, without any trace amounts of really anything else, the makers of Epidiolex will say, well, there's some impure things that we call impurities and that have a little bit of stuff in it, but really there's not much in there. It's really just CBD. We find that most of the kids require many fold higher doses of the Epidiolex to get the same seizure benefit, and often the side effects are much worse. So even if someone has failed Epidiolex for treatment-resistant epilepsy, that is not a patient I would say cannot be helped by cannabis. In fact, it is usually the full spectrum oils that turns them around. And so and now there are some research studies that prove that this is the case in epilepsy, childhood epilepsy in the cannabinoid family. So we have that research. We also have clinical experience using things like nabilone, which is synthetic THC versus high THC oils. I've used nabilone in the past, mainly because sometimes patients can get it covered on insurance because it's a licensed medicine. And what I have found over the years, and why I very rarely use it now, is because patients often get side effects far more often than the same dose of THC, the same milligrams of THC when it's given in a full spectrum botanical extract. So the full
maybe that has to do with other supportive, substances coming from the natural plant as opposed to something. By the way, is that a synthetic? I mean, Do they alter the chemical structure, in order to patent it?
They don't. They don't. So it's most likely coming from what's called the entourage effect.
Okay.
That when you give a full spectrum botanical medicine, just like anything else in the botanical medicine world that we prescribe, you are getting the synergistic effects. So
Okay.
it's not just CBD and THC. There's over 100 different cannabinoids in tiny concentrations, but it depends on the preparation. They are in there if it's a true full spectrum extract. Then you have terpenoids, flavonoids, other things in there. So in answer to the question, the short answer is yes, they are synergistic alongside many of the other plants in the chemicals in the plant. And that's why looking at different cultivars, which is a fancy word for saying strains of cannabis, can make a profound difference in treatment outcomes, especially in the neurodivergent population. So, for example, I have many patients in the practice, both kids and adults with autistic spectrum, on the autistic spectrum, who take medical cannabis. And especially with the adults and older teens, occasionally we have someone, first of all, who cannot tolerate oral products for whatever reason. There's some metabolic pathway that is not working for them. And most of the time we can't figure out what exactly it is because it probably costs a fortune to figure it out. So, we try to repair the gut. We do all the things and say, okay, if this is still orally not effective for them, sometimes we would try a vaporized form of cannabis for 17 years in plus. And when we do that, we often find some patients respond very, very well for autistic behaviors, mental distress, sleep, behavioral issues, that sort of thing. But when you switch the strain, if you don't get the strain right, they can have a completely different effect. So they might feel dysphoric on the wrong strain, even though it's the same percentage of CBD and THC in that strain. So especially certain populations are really sensitive to those other constituents in the plant. And this really needs to be taken into consideration when you're prescribing medical cannabis, in my opinion.
So you mentioned there's over 100 different CBDs, right? Strains?
Not CBDs, cannabinoids.
Cannabinoids. Okay. What about THC? Is there different subtle forms of that as well?
So cannabinoids, so those are the plant chemicals. So CBD and THC are two of the plant chemicals. We have CBG, cannabidiol,
Okay.
THCV, THCA. So we're talking about kind of the cannabinoid family of plant chemicals. Then you have the terpenoids or the terpenes. The terpenes are obviously in many different plants. That's what gives plants their smell, their aroma. And the different terpene profiles of a strain can also change the effect of a strain, making it more calming, more energizing. Carophyllene's better for inflammation. So if I have a patient with migraine or autoimmune issues, I'll try to look for a strain that's higher in beta carophylline. Alpha-pinene's better for kind of cognitive symptoms. And of course, these are in tiny, tiny amounts, but in the right strain, they can make a subtle difference for patients.
So it's interesting, the science has moved and is obviously moving rapidly beyond just sort of this discussion of cannabinoids. It's moving into these other plant substances, which are obviously in other plants and botanicals and even in foods, for example. In fact, I'm reading a book recently, the alpha-pinene you mentioned. I believe it's something that actually gets released by many trees, like pine trees, I believe it is. And they think that has that sort of calming effect, more centering effect you get when you're walking in the woods, and out in the forest. Yeah. So very interesting. Yeah. So it's really interesting to see this start to, move into these other areas and really understanding that there's all of these other subtle substances that can have their own influence. So in some regards, in that particular scenario, you mentioned where you're using a cannabinoid that it's the same percentage, but you give it, one kid does well and you give something else and they don't do well, or maybe not well, but they have a different types of a side effect profile to it. So there's some other subtle aspect happening, within these substances. It's fascinating. So go ahead.
I was going to say, even with ASD, I find a lot of parents who have children with ASD Sometimes they will have already tried an over-the-counter hemp-based CBD product that you can buy without a prescription. Sometimes it does help with anxiety because we know a lot of patients on the autistic spectrum have a lot of secondary anxiety. Sometimes it doesn't help. And sometimes what helps the most, especially with the problematic behaviors, the self-injurious behaviors, sleep, the disruptive behaviors, tics, is actually, that's what the THC helps with. So oftentimes patients will come to me and say, I'm not hopeful that this is going to work because I've already tried CBD and nothing happened. Or in a small subset of neurodivergent children and adults, CBD can make them feel worse. So obviously this is a difference in their endocannabinoid system. We don't know exactly what, but obviously it is something because over the years, you see enough of it. It's definitely a phenomenon. And you talk to other people and they say, oh yes, I've seen this before. So oftentimes it's actually educating the family that actually very carefully and safely, we're going to try a little bit of THC, which essentially sounds pretty scary to people because they think, oh my gosh, my child's going to have brain problems or they're going to get high. And there actually is, good evidence from the kids with epilepsy, and Dani Goldstein is, again, the leading expert in this area. She's treated thousands of patients over 20 years. And she published some interesting stuff around this. It seems that small doses of THC are actually not, especially in brains that are neurodivergent to begin with, so not neurotypical, is actually not detrimental to development. In fact, it helps these kids gain milestones. So I'm not talking about giving neurotypical kids THC, of course. That would be ridiculous. We wouldn't want to give any healthy person anything they didn't need. But it is really interesting that these things can be hugely beneficial and so far seem quite safe.
So let's talk about a few conditions. So epilepsy, obviously there can be many different causes, and the autism spectrum kids, clearly there's multiple issues. And then we could certainly get into different mental health disorders and, neurodegenerative conditions. So these are, each of these topics could be its own interview, right? We could go on for a long time, but I want to just touch on the epilepsy because that's really was my first introduction, at least maybe for my short little trial of the Marinol, years ago. And that really, I think what caught most people's attention is with difficult cases. So, and again, I realize there's different types and whatnot, but in general, so when you're working with a child or maybe an adult who has this condition, what are you expecting to see, perhaps, and maybe what are some other things that you're doing? Because, most of these things aren't always a magic bullet, right? They're being used along with other types of integrative approaches, changes in diet, looking at gut function, environmental exposures. So just, what's your thought process on that and maybe your approach?
So for the kids with epilepsy that we see here in the UK, first of all, the prescribing here in the UK is actually quite, it's restrictive in some sense, meaning you cannot use cannabinoid medicines as a first-line therapy. In Canada, you can. With informed consent, you can explain to the patient, they often come in very informed actually in Canada, that they do not want to try this or that. They want to try this as a first line. But in the UK, you must have tried at least 2 different treatments. Okay. So the kids with epilepsy, we have to be even more careful because it's such a contentious area. Myself and Professor Barnes, who works with me in the clinic, he's a top neurologist, we do this work together. And we're constantly in Parliament talking to government about this because it's so controversial. In fact, I submitted an abstract that was originally accepted for a big conference over here this summer. And then they decided to turn me down because I was talking about pediatric cannabinoid medicine. They decided even for an integrative conference, it was too risky. Wow. So this is kind of the climate that we're talking about. So generally, when I see one of these kids, they've already actually tried a lot of functional medicine approaches because these are very informed families by the time they get to see me. So they've already been usually on a ketogenic diet. They've done a lot of functional medicine testing, a lot of gut stuff, but most of them have syndromic genetic epilepsies, which, they're not curable per se. And a lot of them have autistic spectrum disorder as well, which of course overlaps with the epilepsy. So a lot of times what we see is many of these children have vagal nerve stimulator implants. They have failed brain surgery, like really extreme cases. They've tried on average, and I'm not exaggerating, 8 to 10 anti-epileptic medications by the time they get to me.
Unbelievable. Wow.
Or
Okay.
more. I've had
Wow.
one person try like 15, which is pretty much all of them.
And by the way, do you know if that same thing applies here in the U.S.? I know you've interacted with some individuals here in the U.S. I think one of your mentors is a U.S. physician.
So Dr. Bonnie Goldstein she's a pediatrician who treats children, and she actually treats children across a few different states because she has her license in quite a few states now, I think. It's not the same in that she has more leeway to treat them earlier if she so chooses. And that's not to say that some of my patients do not do both. I have some patients who are on a single anti-epileptic that's worked partially well for them, or we start the cannabis and the cannabis starts to work really well, but then they have a relapse, especially with the immune responsive epilepsies. And then sometimes we will add back in, me, meaning the neurologist, not me personally, will add back in a low dose anti-epileptic. And oftentimes they work really well together. So it's not to say that only cannabis is the solution for every child. But certainly when a child has failed so many medications that have failed to have a seizure reduction effect, medical cannabis can often still have a dramatic effect on the seizure reduction. So it's very rare that you get no seizures, but it does happen. It does happen. But it's more the case where you get a moderate to dramatic reduction in seizures. And how we normally start is it's based on weight, again, and we start with high CBD extracts, which are usually at 20 to 20. Well, usually we start with actually 1 to 100 extracts. So 100 parts CBD to less than 1 part THC. So we're talking about mainly CBD, but still a full spectrum extract. And that's actually really important because some of the kids we see here in the UK have actually got Epidiolex on prescription. They did okay on it or not so okay, but still better than the other medications. But then it stopped working. And that's when they come to full spectrum cannabis. So we usually ramp up the CBD to usually very slowly, of course, very slowly and cautiously, based on the symptoms, monitoring for side effects, to hundreds of milligrams of CBD a day. So usually around 10 milligrams per kilogram of CBD. Sometimes we go up to 15. It's not as common, but it can. Sometimes if you get too high, every kid is different. Sometimes if you get too high on the CBD, people will have adverse behavioral reactions in some of these children. So you really have to keep an eye on many different aspects. And then if you get up to those levels, and by that time, if you're using a 1 to 100 extract, you'll have a little bit of THC on board too, which you have to calculate in as you go. Then you will sometimes add a little bit of extra THC. And then sometimes the third step would be adding a little bit of THCA or CBDV, but this is over many, many months, very, very slowly. And again, every child is different, and usually, there's a ballpark for these things, but it's really titrated individually for the child.
And so this is this is something that I see. Applies to other special needs kids, special needs individuals, regardless of age. It's not a one size fit all type of approach. It's like many things in medicine. It's applying it, reevaluating, changing the dosage, seeing how things go. But, really kind of across the board, I think in general, what we can expect, and you're the expert, is the reduction in seizure onset or intensity or duration. And then when it comes to behavioral issues, let's just take sort of the classic autistic child who has that self-injurious, aggressive, anxiety type behavior. It may not eliminate all of it, but maybe it turns the volume down. It just decreases the intensity within the nervous system. I'm curious what your experience is if we cross over into another patient population, let's say, and again, this is a broad area, but neurodegeneration. Whether that is individuals with dementia, Parkinson's, for example, any sort of things that you've seen that, you've consistently seen perhaps that this is maybe an area that patients who are dealing with these problems should consider CBD intervention?
Yeah, so with a neurodegenerative group of conditions, as prevention is better than the cure in very early detection, like, the work of Del Bredesen, who I follow and, really really rate, it's doing these early interventions for things like the dementia group of illnesses that can be the best approach. But once someone has advanced Alzheimer's or Parkinsonism, which is a whole group of disorders, not just Parkinson's disease, and can include things like Lewy body dementia. You're not going to really reverse the disease process with cannabinoids. I've not really seen that happen. But what you can do is you can help with agitation, mood, sleep, appetite. So that's really the goal of therapy in someone who has a late stage neurological disorder. Someone who is earlier stage, maybe has pre-dementia, there's some, animal evidence and some early evidence that, small doses of THC might be neuroprotective. But we don't, I wouldn't say, I'd say for sure that even at a pre-dementia stage, you can stall it completely, because I don't think we have the research for it. In Parkinson's disease, I do treat Parkinson's disease as well. And of course, patients are on conventional medication as well. A lot of times they tried other therapies as well. And I do a lot of integrative stuff. But of course, sometimes if it's, most of the time, if it's pretty advanced, there's not much you can do to reverse the changes. But again, sometimes it helps with tremor, but 50% of the time it helps with tremor and for Parkinson's symptoms. It can often help with mood, because a lot of people with Parkinson's get new onset depression because of the disease process itself. And you just have to be very careful with patients with Parkinson's, because their blood pressure is quite labile or goes up and down. So even though sometimes it can help with the THC can help with their sleep, their tremor, their mood, you do have to titrate it quite carefully, because it can also make people dizzy, woozy, or that kind of disoriented feeling. But normally CBD on its own doesn't really do much. So you really gotta, the name of the game with medical cannabis is using at least a little bit of THC in most cases.
So what's interesting is you mentioned up front, some of the neuroprotective effects, and I think, inflammation. So neuroinflammation can be driven by many things: infections, environmental compounds, et cetera. And, if you think about neurodegenerative conditions, inflammation can lead to oxidative stress and then internal damage of the cells, wherever it's happening in the brain. And then you also mentioned immune effects. And is there any specific, the immune system obviously is very complicated, but are there specific cells within the immune system that are influenced by these substances, whether it's certain innate immune cells or T cell or B cell function? Any comment on there?
We don't have the evidence to say exactly to that degree of specificity yet, but certainly clinically, what I can definitely say is it usually does help to some degree in autoimmune conditions. I've had people use cannabinoid therapy to help them recover from long COVID. Again, probably because of the anti-inflammatory effect and the effect on the cytokine system, the cascade. What else to say about that?
Any direct mitochondrial effects?
There's definitely mitochondrial protective effects of cannabidiol, and we think probably THC and some of the other minor cannabinoids as well, but it's early. It's in the Petri dish studies, it's animal studies.
Okay.
So we can't say exactly, but I think probably because I treat a lot of patients with fibromyalgia, chronic fatigue syndrome, Ehlers-Danlos patients who have a lot of mitochondrial dysfunction, and their fatigue a lot of times improves from the cannabis medicines. But of course, it's hard to separate it out, because I'm not just doing cannabis medicine. I am also looking at their nutrition. We're doing functional medicine testing,
right,
the other stuff.
Yeah.
But sometimes it's a good, sometimes, I've done so many of these over the years that I can definitely say that a lot of times when people stop their medical cannabis and they're still doing the other stuff, they find that they get worse again. Not all the time. Sometimes people can wean down off the medical cannabis and recover. It depends on what the underlying pathophysiology is. So I think it does have its own effect in its own right.
So here's a scenario for you. And I was just thinking about this as you were discussing something earlier. So we've got receptor function, right? So you have receptors which are interacting with the substance, and then they signal some sort of intracellular reaction downstream.
Yeah.
we know that there's a lot of different types of environmental compounds that we're exposed to, chemicals, metals, other mycotoxins, for example. And I'm wondering if you've seen in scenarios where, let's say let's just take a typical autistic child, right? It's got some behavioral issues and you're applying CBD, therapy, and it's not having the effect that you may be expected. You're like, well, normally in this situation, these kind of things will tend to work. And I'm wondering if you've seen a pattern where if you go work on other things, clean up the diet, improve gut function, reduce or perhaps eliminate certain opportunistic bacteria, Clostridium infections, or lower yeast, that all of a sudden the CBD, when you come back another time, actually starts to have the effect that you suspected it would, or perhaps thought it would. Is that something you've seen?
Not necessarily that linear, I would say.
Okay.
It's hard to say because, of course, in the ideal world, as you know, Kurt, a lot of these patients have to pick and choose what they do because most of the patients in the UK don't have insurance, so they're all paying out of pocket. It was the same in Canada. So a lot of times, we're changing the diet, we're doing other things, but these kids are so unwell, and the families are so distressed and they've tried so many things already that they already qualify for cannabinoid therapy.
Right.
That sometimes we're going to that as one of the first things that I will do, even though other people have done other things with them. But I wouldn't say it's the kids with like high heavy metal hair results that come back that don't respond. In general, THC is pretty effective for most kids with ASD in small doses for behavioral symptoms.
So it's able to cut through. It's like it sort of cuts through all that, cut through the other noise. Okay.
It's what I say to parents is, if we need a quick win, it's really one of the first things I go to, as long as they've met the legal criteria in the UK of, trying two different things. And it doesn't have to be a medication because in ASD, do you really, is it really ethical to make them try risperidone first? You have to make an argument for these patients. And as long as we can back it up in the College of Medicine, then we're happy. And this, I don't make these decisions in isolation. I have a whole team of doctors that work with me in the clinic. It's called an MDT. So we meet about these cases and discuss them. And, generally speaking, it's a way to get a quick win. And then we work on the functional pieces. Some of the kids are so dysregulated that we can't even get a urine sample or a stool sample. They're so constipated and you can't even get their bowels moving because they won't take anything. So it's basically a way to make the process easier for the whole family. And then oftentimes they will need less of the cannabis medicines over time.
I love that. I always sort of frame it, to parents or other patients I'm working with. It's turning down the volume. You're so that. But I love the fact that you mentioned that you just sort of it cuts through some of these other issues. Because you're right. Sometimes in order to actually do the testing or implement other types of interventions, you have to have a child that is cooperative or even somewhat cooperative. It can be a real challenge for certain families. In general,
family too, because it costs money to do these things. So I think sometimes they're so disillusioned. You have to give them a win before the parents are ready to be like, right, okay, we're going to spend a few £1,000s now on functional medicine testing because they trust me that something's going to happen because the cannabis has worked.
That exactly right. That's great. So, just in the few minutes we have left, I'm curious about just in general, contraindications. Are there sort of major contraindications to this therapy that people should be aware of?
Definitely. Like any medication, there's some people you just shouldn't really use medical cannabis, THC in particular. There's actually relatively few, but there are a few. So, for example, in children, there's less of them. But if the child has already been diagnosed with bipolar disorder and they're having manic episodes, obviously you want to be really careful with THC. If obviously this is more for adults, but adults with schizophrenia or have two first degree relatives with schizophrenia, again, you want to be careful with the doses of THC. It doesn't mean you can't use it, but you want to be very cautious because we do know in certain vulnerable brain populations, if you give someone a whack load of THC and they're more vulnerable genetically to some developing schizophrenia or another chronic psychotic disorder like schizoaffective disorder, that it could potentially tip them over into a first episode of psychosis. That being said, the relationship between THC, cannabis, and psychosis is actually very poorly understood. And in fact, it is the case that THC doesn't cause schizophrenia. And most of the people who smoke way too much, hundreds of milligrams of THC and have a psychotic episode, over 80% of those people will never go on to develop a chronic psychotic disorder. It's what's called a single drug-induced psychotic episode. So, and we're talking about the extremes of recreational use here.
Sure.
In the medical world, I have never had a patient ever that I prescribed that has become psychotic, but I have had a few colleagues who have had cases over the years. And it's usually the patient who there's a few red flags, but we proceed cautiously, and then they take more than the recommended dose, and they're already a little bit high risk, and then they can have an episode of psychosis. So from THC. CBD is very safe in that respect. Other things that you want to be cautious of, if someone is on immunotherapy for cancer, there's certain immunotherapy agents that, because cannabis is such a good anti-inflammatory, it might have a detrimental effect to the immunotherapy. So I don't combine them in certain immunotherapies when they're ongoing. So for example, some lung cancers that use immunotherapy, melanoma, I wouldn't actively combine cannabis at the same time as they're going through the immunotherapy. Those are the main kind of caveats. Obviously, if they have an unstable heart condition, the same thing with THC, it can increase the workload, the cardiac workload. So you want to be careful with THC dosing. These types of cautions are necessary, but in general, you can use it at least very cautiously with most people.
That's great information. I mean, really what impressed upon me is that this is something that just people shouldn't just be sort of randomly trying, Yeah. They really need to be guided through the process. So what do you say to the patient, parent who says, well, I'm using hemp, CBD, and it didn't work. So, I don't, it's not going to work. What is the difference?
So hemp doesn't have, usually anyways, unless it's been adulterated, it doesn't have more than 0.03% THC or 0.02% THC to be qualified as hemp. In the UK, it doesn't have any THC. They all have to be THC free. So that's when we're talking about the effect of THC. So I have loads of patients. I would say at least 50% of the patients who see me in the clinic for the first time have already tried CBD and it didn't work for them. So that's when we have the discussion about how THC works differently at the receptors, how it's, we're trying. And, I do have the occasional person where cannabis just doesn't help them. It does happen, just like with everything else. It doesn't work for absolutely everybody. But it's one of the things that I would say helps the highest percentage of people that I've found as a medication, if that makes sense.
What's the typical duration of use? I mean, if you were going to apply this intervention, is there a certain time frame that you have, 60 days, 90 days, maybe a little longer, to say, okay, we've given it a good go, it's not working, let's move on to something else?
Like you, Kurt, I go by 30 days to 90 days. So after 30 days, I want to check in and see, is there any change? And most importantly, is there any detrimental effects? So for example, if I'm giving someone a very small dose of a high THC extract for their sleep and their night pain, if after 2 weeks, they're one of the small percentage of patients that's having a paradoxical reaction to that, meaning it's making them more wakeful. Obviously, I'm going to change that before the 4 weeks is up. But if I have a patient who is having no side effects, they're tolerating it well, and they're getting a little bit of relief and a little bit more, we go to 90 days. And then after 90 days, we say, okay, how much improvement have we had in the different symptom clusters? Because we're usually treating multiple symptoms at the same time with cannabis. So we're usually treating pain, sleep, mood, fatigue, all of the above. And sometimes some of those clusters will improve more quickly than others. And sometimes we have to add other things for the other symptom clusters. So generally speaking, 3 months is a good one.
So I know you get this question. I get it a lot. Well, how long do I have to use it for? Or how long will my child be on this? I just want to put it out there, for the audience. What are your thoughts on that?
Well, what I say to parents and to adults, patients, is, this is not a cure. So we're not permanently fixing something in your endocannabinoid system. We're supplementing it. It depends what we're treating. if I'm treating someone with PTSD or anxiety disorder, and the cannabis allows them to go through therapy, whether that's conventional therapy, EMDR, obviously we do the functional stuff as well. We clean up their gut. In some cases, we can get them into a trial, sometimes for psychedelic medicines. And sometimes I've had patients, I just had one the other day who I discharged because he saw me first for cannabis. We decreased for PTSD, we increased his anxiety level. He was able to start tolerating EMDR, then some kind of somatic work. Then he went and did a course of ketamine therapy, which I referred him for, and did a bunch of psychedelic-assisted psychotherapy. And he's just, I would say, I mean, I don't want to say permanently forever, but he's been able to come off the cannabis. He's not on any psychotropic medications, and he's just better. He doesn't need to take the cannabis anymore.
Yeah, right.
He doesn't need to take the antidepressants anymore. Doesn't need to take the sleeping pills anymore. So it is possible to use it as a tool to get someone back to well-being. I would say the same with long COVID. Sometimes the same with fibromyalgia, but it depends on the person. But then you have things like, lifelong conditions. So some kids with autism, sometimes you get lucky and you clean up the diet, and they're almost 100%, the diet and the functional medicine, they're almost 100% normal, quote unquote. But then you have other kids who, are always going to be non-neurotypical. And those are the patients I'm really honest with the parents, like this is probably going to be long-term therapy. Same with epilepsy.
My feeling about these types of interventions, like many things, it's early in its use and research. And so there's a lot more to learn. There's a lot that's known, there's a lot more to learn.
Yeah.
And like most things in health and medicine, even conventional medicine, there is the trial use. You're using things or implementing things to see if it helps, because the chances are it's going to be helpful as opposed to being detrimental. So something like this, there's always the potential for a reaction, or somebody may not respond well, but by and large, there's going to be a greater chance it's going to help to some level. It may not be curative, but it is helpful. And that's the whole point in these types of interventions. There is hope that help can be achieved. And that might be 10%, it might be 20, it might be 50, it might be 80%. It might be that it's used for 3 months and that's all they needed. Maybe it's a year, and others it's more long-term. So it's very unique and individualized, like a lot of things are in the type of health approaches that we have. So great information. So for, my audience is very broad as far as, here in the US and internationally, of course, being a podcast, people can listen wherever. So we know in Canada, it's used or accessible, probably even maybe more so even here in the US, probably depending on the state that you're in. The UK obviously has restrictions, and I think some of them are certainly necessary. I think sometimes they go overboard, with how regulated these things get. But I'm curious, just in general, what is your sort of general recommendation for patients or people out there who are saying, hey, I'm interested in this? Are there organizations that you know of that are trained practitioners that people can look for to say, this person's been through this training, and so therefore they have a decent amount of knowledge? Any suggestions on accessing more information or what people can look for?
It's a really good question. There's not really a centralized place. There's different organizations, definitely, but I would say if you're in the US or Canada, look for a medical doctor, if you're going to get prescribed medical cannabis, especially for pediatrics, that has experience prescribing medical cannabis for children or for adults in the area that you are seeking attention for. Normally they'll be, they'll have mentoring, they'll be involved in different organizations, some of which I can't remember the names of right now because I'm a member of so many in the UK now that the other ones are now escaping me. With my pregnancy brain. Here in the UK, I am the current vice chair of the Medical Cannabis Clinicians Society, we're all volunteer doctors who run a nonprofit society here in the UK. And that's our main mandate, is we train physicians. So in the UK, if you see someone, if they are a member of the MCCS, they've taken our training course, that's a good starting point. And, if they're active members. But yeah, it is quite a patchwork. I know Dr. Scott Shannon, Dr. Mark Bronstein in Colorado are fantastic. Bonnie Goldstein in California. There are people pretty much everywhere. My colleague at University of Toronto, Dr. Evan Lewis. There's people pretty much everywhere who are pretty well qualified, but you do have to be a bit careful because medical cannabis, there are a lot of clinics, and unfortunately in the UK, this is most of them. We're the only one that's an integrative clinic. The rest of them are cannabis clinics that are actually funded by cannabis companies, and all they do is prescribe cannabis. And they're just conventional doctors who've taken a few weeks of training, and then they just prescribe cannabis. And unfortunately, that's happens a lot. So you're not going to get the nuance with those people that we see in the integrative medicine world. It will work for some people, but it's obviously nicer to have someone who's trained in botanical medicines as well, because you get that more individualized care.
Well, and I think that's really important. The shotgun approach is, some people might get benefit, but when you start working with complex issues like you and I work with, you need somebody who's trained, you need somebody who's experienced, you need to understand the subtleties and the differences in how people react and be able to recognize it, and that's part of it, is recognizing when something is not working to be able to move on and know what to do next. So I love that. So you have a website and you've written a couple books. Tell me about your books and your website where people can get more information about you.
So my website is I just changed the domain. Let me think about this. The LondonResilienceClinic.com. So LondonResilienceClinic.com is the domain. And my books, the first one that I wrote is called The CBD Bible. It is about medical cannabis. It has all the THC info in there. I had to call it that because when I wrote it, no one would publish anything that had the word cannabis or THC in the title.
Oh, wow. Interesting.
So that's why it's called the CBD Bible. Anyways, and then my second book is called The Resilience Blueprint, and it's more about integrative, holistic medicine approaches to becoming more resilient.
And you told me at one point, I don't remember which one, but one of the books was more sort of oriented towards medical science, maybe the practitioner level. Others were more to the general public, but maybe that's an oversimplification.
Actually, they're both very much oriented towards the general public, because I'm with a general audience publisher that's very kind of broad readership. However, if you are a practitioner listening to this, I would highly recommend Bonnie Goldstein's book, which is called Cannabis is Medicine, because it is absolutely fine for the layperson, but it's slightly more for practitioners. And then there's a few other documents, books that are not as widely published, but from Dr. Ethan Russo. So if you look up Dr. Ethan Russo books, his will come up, and those are very much for practitioners.
Excellent. Well, this has been tremendous. I've learned a lot, as I mentioned up front, even before we went on the recording. This is an area I've known about, but have not done a deep dive into. I certainly appreciate the science, and I really appreciate the expertise to actually learn how to use these things appropriately, because I know how complex many patient populations can be, how complex the autistic kids can be, how complex certain types of individuals with mental health challenges, long COVID, all of these other things. These can be complex conditions. And so just sort of randomly throwing something to see what sticks, is really not appropriate. And you've done the time and put in the work and have the expertise to really be able to pick up on the subtleties of it. So I really commend your work. So thank you so much.
Thanks, Kurt. I feel the same about you, as you know.
All right. Thanks so much.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Wohler. For more information about this podcast, go to functionalmedicinedoctalk.com.